Sensitivity and specificity of orthopedic examinations. I still have a hard time getting those straight. However, when I think about an orthopedic test, I think about what do I need to accomplish with a patient. I need to correctly identify what tissue has been injured. And when it comes to tests, we're really looking at the sensitive test for that. What test can actually rule in that diagnosis? A test is positive, that person has that diagnosis. Consider this though, that if I pick my arm up, that would be an orthopedic test. And while that may reproduce pain associated with a supraspinatus tear, it also is going to irritate the AC joint. It's also going to irritate a labral tear. It's going to irritate any kind of a bursitis. It's going to irritate a cervical radiculopathy sometimes. So while those tests are great and we need to have those tests, consider also using clinical prediction rules to rule out a diagnosis. Now it turns out Grahn et al. Put out an awesome paper just this year, in fact just this month, on how we can use clinical prediction rules for the upper extremity to rule out diagnoses. So when you can use upper limb nerve tension tests and you can get all four of those are negative, then we can take and say, hey, this is not a cervical radiculopathy. Now, sometimes it's clear. Sometimes we can do our history and our examination and we do our orthopedic test and our functional test and we know exactly what's going on. However, this sometimes is for those patients that things aren't going right. We think they have a cervical radiculopathy and we go about our treatment plan and 1 week out, they're still the same. 2 weeks out, they're not making appropriate improvement. Then go back and say, do I truly have this diagnosis? And I think if we can have these kind of clinical prediction rules, we could say, you know what, for this kind of a case, maybe I'm on the wrong region. I hope this helps because I think that when we can take a diagnosis and rule it in, that's very powerful, but sometimes we get a knee-jerk reaction to hearing something in our office and quickly saying that that's probably just this. However, it's those patients that aren't getting better that we need to put our hats on and say, what else could it be? Dr. Burrows and myself just put out another condition report to the board. It's going to be on ischiofemoral impingement. Another one of those that when you get that deep-seated ache going into your thigh, sometimes we just get lulled into it's just sciatica. However, this is another great resource. It should be in your hands within the next month on how we can take and say, you know what, let's look a little bit deeper and see if we can maybe rule in or rule out a different diagnosis to get better clinical results and better patient satisfaction. If you want any other information on this blog, check out ChiroUp. All the evaluations, all the treatments, all the infographics are located there. Thanks.